right, welcome everyone. I am Craig Escudé. Most of you probably know me. I'm a family physician. I've spent the majority of my career providing healthcare for people with intellectual and developmental disabilities. I was the medical director of Hudspeth Regional Center in Mississippi, and I'm now the president of Intellectability. And our talk today, I'm really excited to have our guest with us today. Our guest is Dr. Rick Rader. I'll tell you a little bit about him. He is the director of the Habilitation Center at Orange Grove Center in Chattanooga, Tennessee. He is the editor-in-chief of Helen, the Journal of Human Exceptionality, and has published well over 300 articles. He is the co-founder of the American Academy of Developmental Medicine and Dentistry, the president of the American Association on Health and Disability. He has been appointed by the president to the National Council on Disability. He is the medical advisor for the National Alliance of Direct Support Professionals and an adjunct professor of human development at the University of Tennessee, Chattanooga. And that is only the beginning. There's just no way we could spend a half an hour talking about all of Dr. Rader's accomplishments. Most importantly to me, he's a great friend and a great resource. And I can't wait to share or have him share his insights with us today. Hello, Rick.
Hey, how are you, Craig? Thanks so much for having me. And thank you for that introduction. It's not every day I get to hear my eulogy while I'm still alive. So that was good. After hearing that, I can hardly wait to hear what I'm going to say.
All right, well, let's move on. And I want to start with a quote that when we were talking about this webinar that you said, and I just thought it was wonderful. So I put it on the screen here. Don't leave home without knowing the keys to a purposeful medical appointment. And Rick, I'm going to start off by asking you to tell us what you mean by that.
Yeah, well, I think one of the key words other than keys is basically purposeful. You know, there are medical appointments that are substantial, that basically have great outcomes, and then there are others in which basically it's a face-to-face and a shoulder shrug and really nothing is done. And all of that has to do with preparation. You know, we usually use the take-home message at the end of a seminar or a webinar or a conference. I want to give it to you now, basically, because I think it's going to permeate through everything that we're going to talk about. And I'm going to use some language that people might raise an eyebrow, but let me explain it. And it was when I was a tank mechanic, basically, years and years ago. We used to have this axiom, and it was basically the 7 Ps, and it stood for proper prior planning prevents piss poor performance. And when I use the word piss, let me say it's an acronym for the things that you need to have in the back of your mind. For one thing, you know, the P stands for predict. How do you predict what's going to happen? Because that basically will allow you to watch out for the landmines. You know, the I in piss, basically, I say imagine things that can go wrong with this thing and prepare for it. The other one is use your intuition based on your knowledge of the individual and helping you prepare for that. The S, I basically say suppose to yourself, what if this happens, what would you do? There's also an S for silence. Take a moment, a brief moment to evaluate what exactly is happening in front of you. And the last S basically would be sequence. What needs to be done and in what order? And basically, if you could put those things together, that should be your take-home message on what you need to prepare to see a clinician. And obviously, we're talking about not just physicians, but we're talking about nurse practitioners, mental health workers, you know, nurse practitioners, etc.
Well, I tell you, Rick, I now have a new perspective on that particular word and what it means. So I appreciate you sharing that with me. So let's get into some of the nuts and bolts here. And one of the first things we need to do is knowing the purpose of a visit. So if we are supporting someone or accompanying someone to a healthcare visit, there are certain things that we need to know about. And so, Rick, I'm going to ask you to elaborate more on what you mean by knowing the purpose of the visit.
Sure. Well, basically, there's lots of flavors for going to see a healthcare professional. Routine physical is your wellness physical that happens once a year, and that's basically not only good, sensible medical and healthcare, but in a lot of jurisdictions, it's required basically as providers to ensure that those individuals, and also when we're talking about the purpose of the visit to a clinician, let's not forget that, one of the very, very fundamental aspects of good healthcare is oral healthcare. So these same things have to be appropriate and applicable to going to see the dental hygienist or the dentist themselves.
Makes sense.
Yeah, and then basically, there's a follow-up, and the follow-up could be for abnormal lab values that were taken during the routine physical, or to evaluate the progress of a treatment, or to change the treatment, et cetera, et cetera. Pre-employment physical, one of the purposes of the entire disability movement in the community is to make sure our folks are well prepared to get some sort of job, whether or not it's a volunteer job or an internship or a full-fledged competitive employment. Very, very often new jobs will require a pre-employment physical. And also going away to higher education. A lot of colleges will require that too. Recent onset of concern, everything's going great, and all of a sudden they announce that they don't want to take showers anymore, or basically food preferences are changing, and or pain, or referral by a specialist. Basically you've gone to your family practice doc, because you have pain in the shoulder, and basically they've done the rudimentary things and they're still not getting what you need in terms of feedback or basically improvement, and so you basically go to a referral. There's also, other things, like there's medical clearance for participation in athletic programs like Special Olympics.
Sure.
And then also, and this is something that most people don't appreciate in terms of going for a purposeful, investigation. And it could be also to enroll in a clinical trial for new medications or for new protocols, et cetera. And those typically start with the clearance by the investigative clinician too. So, and our folks, deserve to be in clinical trials as part of the community. So that's something that I'm very, very happy to see has changed in the environment.
And when a supporter knows the purpose of the visit, they know the reason for a visit, it makes it easier to ensure that it's met, that's what's actually done. Well, they're here for a pre-employment physical. Do I have the form that's needed to be completed? Can you provide this, or let me not leave without this form? So understanding why the person's going to the visit is extremely important, and certainly the first step.
Right.
So when we look at what else, it's really helpful if the supporter and the person with the disability know about the provider. What type of provider are they? And also, would you elaborate more on that?
Sure. Providers like caregivers come in all flavors and sizes. And basically, so you have a generalist or the family practice doc or the pediatrician if we're talking about youngsters or children, et cetera. A specialist, there are 24, recognized medical specialties. And basically, so is this person a cardiologist? Is this person an endocrinologist? Or is this person a neurologist? And knowing the specialty of that individual will help you prepare and understand what is the purpose of this particular. Obviously, you probably should not necessarily feel that you're obligated to bring a bowel movement chart to a neurologist. That's not to say that that would not have a connection, but off the top of my head, I would think that they're there for a different purpose. Nurse practitioners, physician's assistants, certainly. And basically, a lot of us realize and appreciate that nurse practitioners and physician assistants have excellent, excellent outcomes in terms of providing additional time. Maybe they have been trained to appreciate the psychosocial aspects of that individual more. Does this provider have previous knowledge of the person? Is this the first time they're being with them? There's a big, big difference between the relationship of going to a clinic in which you're seeing different providers every single time and going to a private practice in which basically you are assigned to an individual physician or provider, and they can see you over time across your lifespan, hopefully. Does this provider have knowledge of IDD healthcare? One of the sad things is our individuals, our population suffer from great healthcare disparities. And one of the reasons why these folks don't get the healthcare that they need is lack of preparation on behalf of the provider. You know, there are 200 US medical schools. There's only one medical school out of the 200 that requires and mandates exposure to learning about this population. So you're talking about between the number of medical students that graduate, physician's assistants and nurse practitioners, you're talking about 51,000 graduates every single year. And there's only a handful of them that have any previous knowledge or experience, confidence, and skills. So therefore, very often the DSP or the family member who's escorting the patient, you know, they basically can provide a lot of background information that healthcare worker doesn't have, et cetera. Do they welcome people with their IDD in their practice? You know, the reality is, you know, because medical students who then become doctors have not been exposed to this, by the time they become practicing physicians, a lot of them have no experience, no confidence, no skills in even corresponding with them or communicating with them. And those are all negative aspects that put basically, you know, put you as the DSP with one hand behind your back, because you certainly want to be respectful to those, you know, et cetera. And does the provider want to know the social environment in which the patient comes from? Because if they show an interest about the patient narrative, where do they work, who do they live with, what are their dreams, what are their fears, what are their phobias, what are their sensitivities, those things basically serve two purposes. One, it presents the humanity of the individual to the physician, and it can also change the scope and the trajectory of the treatment plan if they know exactly what the other components are. And so that's real important to know as much about the provider as you can.
Yeah, I think it's great. It helps the supporter, it helps the DSP or the nurse or whoever's accompanying the person know the best way to interact with that person. If they know,
Correct,
you know, their experience, their background, what's their understanding of healthcare for people with IDD, do they know that person well? And so that's a really excellent point.
and that also, you know, when the DSP or the escort shows an interest and a knowledge base, it fortifies the relationship to the provider. You know, the provider says, wow, this escort really cares about this person, knows about this person, and therefore they're coming from a bastion of support. You know, there's nothing worse to send a message to a provider who's willing to see our population, and not everybody is, if basically an uninterested, uninformed person escorts them, and the doctor originally says, well, if they don't have information about them, what do they expect me to do? And so basically the DSP serves as a bridge maker and as a relationship maker between the field and the medical folks.
I can't tell you how many times, unfortunately, I heard when I asked the question to a supporter when I was asked to see someone and say, well, what's the reason, you're bringing him to see me? And they say, I don't know. They just told me to bring him here.
Exactly.
And yeah, that's not what we want to hear.
Yeah,
So
that sets up a very negative relationship.
right. So how does supporters prepare themselves for an appointment?
Okay, well, for one thing, they have to have an understanding and appreciation of the so-called HIPAA regulations. Now, HIPAA basically fortifies and protects protected medical information, et cetera. But there's a lot of mythology about HIPAA. HIPAA was really intended to share medical information to those individuals that have a right and have basically a power and have the need to know. It's not to keep information out. It's to ensure that the information gets to the person that has the best use of it. For instance, even a neighbor who drives an elderly person to the doctor's office has a right to be in on that appointment and to learn exactly what it is, because, you know, so much of a medical appointment is substantial after the appointment, et cetera. So basically, you know, the DSP or the escort needs to know what they are eligible to hear, because so many times they'll hear from low-level office staff basically that, well, we can't tell you that. That's protected information, and basically saying, no, I have been named by this particular patient as someone who is eligible to hear that. So that's very important, because you need to have access to the information in order to ensure whatever the proposals were for follow-up care are carried out. Also, the individual DSP needs to stay for the entire appointment. This is not DoorDash. You know, they're not just dropping them off and saying, well, okay, I'll be back in an hour. Not only do they need to be committed to stay for the entire appointment, but very, very often they need to be in the examination room to provide additional information, to provide support and comfort to the individual, et cetera. So that's important. And they need to basically prepare all the information that that provider, even the well-known provider, basically, you know, they could have 2,000-3,000 patients. You know, you can't expect them to remember what the BP rates were last time or what the sleep apnea scores were, et cetera. So basically having access to medical records, and this is not done at the last minute, medication lists, tracking logs, seizure, glucose, bowel movements, et cetera, sleep patterns, et cetera. Any note that you feel that doctor needs to know in order to really have a fundamentally, you know, functional medical appointment. And also be professional. Do not be distracted. The last thing you want to be doing is sitting in that exam room looking at your cell phone. You're doing a disservice, and I would say that's probably neglect.
And the better prepared a person is for the appointment, the more information sharing that will occur, and more likely there will be a better outcome as well too.
Absolutely. There's a formula that says garbage in, garbage out. So the accurate information needs to be accurate, and you know, I'm sure we'll have something else to say about that.
Yep. So another important thing to know is, were there any instructions provided that should, you know, things that should happen before this person goes to the appointment? So let's talk a little bit more about that.
Yeah, and that all goes through preparation and basically the piss poor performance that you want to avoid. You know, for instance, if you know this person's going to get a full body examination, you want them to wear comfortable clothing that could be easily removed and put back on, you know, especially if the individual has mobility problems or hand coordination problems. You know, maybe they need some Velcro clothing, maybe they need slip-on shoes, et cetera, et cetera. Communication device, you know, if the individual has an electronic communication device, that needs to be brought along, because you want the individual to participate in the communication, not just sit there as a bystander. Possibly they're telling you, you know, have nothing by mouth after midnight the night before because they're taking a test and you don't want the test to be you know, coming out bad as a result of that. You know, also they might want to know if you took your medications this morning, and they might have said, do not take your medications this morning, because they need some lab values that are based on whether or not they are basically in the system or not. And maybe pre-appointment medications, possibly it's something for anxiety if they're, you know, they're doing that. And bring items of comfort. You know, if somebody has a piece of felt that they like to keep in their pocket, or a rabbit's foot, or basically even a doll, or basically a funny hat that they wear that they're comfortable with. Anything to basically alleviate the anxiety that all of us have when we go to visit for a physician.
Yeah, and we're going to talk about, you know, the accommodations for an office visit on this next slide. But even when we do our best to try to help someone, you know, have the most efficient appointment, sometimes wait times can be longer, and having those types of items can be really helpful. Correct. And then the communication device that made me think of something else is, you know, yes, ensure that the person has the ability to communicate to the best of their ability. That might include a device or pictures or books or something else that they can use. But also, I think it's important to emphasize to help, you know, help the clinician recognize that they need to communicate with the patient as much as possible, and not just their supporters as well too.
Right, and that has to be done and promoted to the physician in a very respectful way. Yeah. You know, basically that something as simple as saying, hey doc, Johnny needs to hear that, you know, from you directly, or, you know, only Johnny can answer that question best, or et cetera. So that's very, very important. That dignifies the relationship and basically shows respect that we need to always provide for our folks: dignity and respect and inclusion.
Absolutely. So what about reaching out to the office beforehand? Is that something you recommend?
Yeah, upwards of 70% of the individuals that we support have some sort of sensory impairment, either sensory overload or sensory sensitivities, et cetera. And the knowledge of that, and provide that knowledge and those requests for accommodations to the office staff, hopefully before you knock on the door, before you get there. And it could be basically the room. Some people don't like to be in close encounters. Some don't like to be in open spaces, et cetera. Um, some don't like lighting, or basically some like the lighting to be dimmed. Some people don't like the piped in music that very, very often, or very, very often in waiting rooms, they have TV shows going on, whether or not it's the news or something, the weather, et cetera. Um, and the waiting times and the limitations. It's interesting that usually, typically, when you come for an appointment and you basically are asked to sign in, the sign-in sheet has your name, the time of your appointment, and also the time that you arrived. But it doesn't indicate the time that you wait in the exam room when they bring you in to prepare you. That could sometimes be 15, 20, 25 minutes from the time you're brought into the exam room, asked to disrobe, to be put on a gown. Maybe the medical assistant comes in to do some vitals, and it could be another 20 minutes until the physician comes in. Some of us don't wait very, very well. Some of us get agitated. The fear, the phobia of what's going to happen just lingers on. And so basically, if you have a very, very short fuse for waiting, I think that you need to ask for special accommodations.
Yep.
Possibly the less the less interval time might be in the morning. So basically, if you might want to be the first person in the office that way, et cetera.
Yep.
It's all basically, and everybody's a winner from that. It's examining somebody with low anxiety so that you get a true reading of how they are, naturally. The so-called white coat hypertension,
And
can really
I
be the
think
difference between being prescribed medication and not.
Yeah, and I think that's one of the things that shows the importance of developing maybe a relationship with the office staff,
Right.
especially if you work for, say, a larger agency and you bring a number of people in, is develop a relationship with the people in the office to help these accommodations occur and facilitate better
Yeah.
visits, like you said, for everyone.
And there's another thing that needs to be requested that we didn't list it, and that's seating assignments, basically.
Yeah.
If the office, some offices only have couches, and that's difficult for a lot of our individuals to get comfortable in or to seat. Some of them would prefer to have a single chair, with arm rails. It makes it easier for them to get up and to get down, et cetera, without basically needing assistance. So,
Absolutely.
yeah, and
So when someone gets to the appointment, what do we recommend? What do you think is best to happen?
well, I think the best thing to do is for the DSP to introduce themselves, to the nurse or to the receptionist, et cetera, and basically say, "Hi, I'm Bill. I'm here for the patient visit with Ed, and I wanted to thank you for making the accommodations that you have agreed to." And that's a reminder, basically, that everybody, regardless of where you are on the spectrum or whether or not you have an acquired or genetic disability, especially the elderly people, they basically get exposed to a lot of the same difficulties that our folks have had for a lifetime: mobility problems, confusion, memory, anxiety, forgetfulness, et cetera, fear and anxiety, et cetera. Um, and basically, you might want to remind the receptionist we put in a request for a chair. Can you show us which chair you'd like us to sit in, et cetera, et cetera. Um,
Very good.
and make that connection. And also at every opportunity to show appreciation.
Yep, I like that very much. What is it that you get catch more flies with honey?
Absolutely, honey.
So, all right. So at the appointment, what about the next steps or knowing the next steps? We know that that's important. Is to know what's the outcome basically of the visit and what do we need to do next?
Yeah, basically. So You know, I always tell my individuals, you know, my escorts, I said, do not leave the office until you have two things. One, the individual who you brought, you know,
That's important.
and that's tongue in cheek, but that has happened. Like, you know, folks come back to the center and we said, where's Billy? Oh, he's still in the exam room, you know. Okay. So make sure that you bring him back and basically make sure that you have information about what occurred. And that's very, very important. You know, information about appointments for follow-up visits, either to come back to that office or basically a referral to a specialist. Any changes in medication, either discontinuing medication, changing the frequency, the dosage, or the delivery, et cetera, the treatment plans, any changes in the diet. Maybe you went to a GI and basically they found out that you have a gluten allergy. Well, it's not enough just to have that stamped on your chart. Basically, you have to talk to the house manager or the dietitian to ensure that those dietary suggestions are followed. You know, you go back to Hippocrates, and Hippocrates says, you know, food is medicine, and basically we need to continue that mentality. Have all your questions answered. It's not unusual for people leaving a doctor's office to not understand at least 50% of the dialogue. That's why even couples, you know, married couples, husband and wives, parents and children, siblings should attend the medical meetings themselves, because you need somebody to say, I believe that he said that he wants you to, you know,
This or
start
do that.
wearing wool socks or something like that. Um, and basically, the other thing that's real important about in terms of the next steps is the instructions on what they told you to observe and record for future visits, such as sleep patterns, you know, bowel changes, confusion, irritability, or changes in food preferences. Especially with our individuals, very, very often, the first thing to signify a change basically is a change in behavior. You know, they may not have the wherewithal or the communication skills to talk about things that hurt them, etc. And basically, even something is, gee, he's always liked chocolate pudding and now he won't touch it. Or he's always preferred showers and now he just wants to take a bath. Or basically, he doesn't want to sleep in his pajamas anymore. Those things are not shoulder shrug suggestions. Those things are alerts. Something's going on here. What is it? And they could be very, very pivotal milestones in healthcare.
I love making that point over and over again is, you know, a change in some sort of action or behavior, there's a reason for it. And it could be a medication side effect. It could be an underlying medical problem. It could be a social situation, you know, but there's a reason, and we need to look for those.
Right.
So knowing the next steps and knowing what needs to be done and knowing about these things are important, but we also have to be able to communicate these to the person and to the team and the rest of the support staff.
Correct. Probably one of the most important things that the DSP should see themselves as, in addition to information gatherers and escorts and comforters, probably I would say the most important role that DSPs or any caregiver plays is that of an advocate. And, you know, what is advocacy? Well, it comes from the Latin word avocare, meaning to walk alongside with someone, especially with our population who historically cannot necessarily be self-advocates, that you have to be an advocate. One of the things that you have to do basically to declare yourself as an advocate is to realize that the patient is also part of the team. He's not the object of the reason that you're there. He is basically the subject of why you're there. And so you need to know, what is the outcome of the visit? You know, was it something that they say, okay, everything's great, continue medication, see you in 6 months, enjoy Special Olympics, etc. That's one thing. It could also be, the outcome could be changes and recommendations for new ways of living, increase or decrease exercise patterns, etc. Follow up in 3 weeks after you finish taking the medication to let me know. And basically ensure the person that is the center of the reason that you came to the physician's office understands, to the extent possible, what's going on, how they feel about it, their willingness to basically participate in being compliant and adherent to that, etc. and also to find out whether or not the patient really wants to go along with this. The patient narrative is very important, and I think that that's important as well.
Well, I think all of this is extremely sound advice and can be very helpful in preparing for clinician visits and accompanying someone with a disability to a healthcare provider visit to help
Yeah.
ensure the best outcome possible.
And one of the other things, Greg, is also, what new insights did you learn from that visit that might be of value for further visits? And basically, it might be of information that you want to share with the other DSPs who will also have individuals that are going to that same provider. Let's say it's a new policy change, or let's say it's a change in personnel, et cetera. That's real important.
So we started with a comment that I remember you saying, and you also said this: people thrive on compliments. Be sincere and give them freely to worthy staff. It will go a long way. And I can't agree with that more.
Yeah, well, you know better than anybody that medical offices are typically very fast paced with very narrow appointment overlaps. The support staff basically will typically try to move things along for the flow and what they call the momentum of the office. That being said, they're also obligated and expected to be pleasant, professional, and accommodating. And very often that's what you see. And when you do, they, like all of us, welcome positive feedback, and it helps to make the office culture disability friendly. All of us have heard so many times when we try to make an appointment, quote, "We don't accept those kind of patients." And basically what we want to do is we want to, hopefully, by being good role models, we want to change the culture of those offices to say, yeah, we'd love to see Johnny. What do we need to do to basically make his visit as disability friendly as possible? So that it goes a long way.
Absolutely. Couldn't agree more. So that brings us to the close of this webinar. We try to keep these concise. We want to provide you with helpful and usable information. Some of that usable information comes in the form of handouts. There is a handout that is in the handout section of your control panel that is information about the health passport, and it's a document that can be used to help increase and improve communication and help supporters and clinicians and hospitals understand more about that person beyond just medical needs that they have, but also how do they interact the best? How do they show when a person is, how does the person show when they're experiencing pain or something along those lines? So take a look at that. And there's also additional information there. We invite you to participate in the survey that's there as well too. I want to remind you about a couple of other things, and we will get to a couple of questions that we have, but I want to remind you about the IDD Health Matters podcast. We just released our 90th episode this week, and I'm happy to say that Dr. Rader was number one. He was number one episode, the first episode of IDD Health Matters. So I'd encourage you to go back and take a look at that, and also to look at some of our other IDD Perspective webinars that we have coming up that address a number of topics related to this field, and you can find that on our website at replacingrisk.com. Now, I do want to get to a couple of questions for those of you. I know we're a little over our time. If you have to leave, that's no problem. But one of the questions, again, it's a question I never thought I would get, but can you please repeat the full acronym involving PIS at the end of the webinar? So, Dr. Rader, would you please repeat?
Sure. It's as I said, it's proper prior planning prevents piss poor performance. And if you take the letters PISS, one, the P should stand for predict. Predict exactly what you're doing and what could happen when you get there. The I is imagine. Imagine things that can go bad. Use your intuition by your knowledge of the patient to prepare for things, etc. The S stands for suppose. Say to yourself, suppose this happens, what would my reaction be? What would the best reaction be, etc. The S also stands for silence. Take a brief moment to evaluate the scenario, etc. And the S can also stand for sequence. What needs to be done and in what order? And if you put those things together, basically that can give you the framework and the blueprint for a successful visit. And I just want to say something about a successful visit. The successful visit begins and ends with the dedication, the commitment, and the professionalism of the DSP. And basically, I can't say enough for those good ones.
Thank you for that statement, and also for re-explaining the acronym there. And again, you will get a recording of this webinar, so you can listen to it again. A couple of other quick questions. How do we find out about clinical trials? Is it the physician that usually suggests that, or are there other ways to find out about clinical trials?
Yeah, there are several doors to the clinical trials opportunities. One would be basically and it would be typically at a specialist, whether or not it's cancer or endocrine, et cetera, where they know, because they could be the clinical investigators of that particular clinical trials. And basically they can say, you know, on the surface, it appears that this individual would qualify to be eligible for it. And so here's some information. You could also go to the National Institutes of Health. They basically have a website for clinical trials based upon the specialty or the organ system. So if basically you have diabetes and you wanted to find out what new clinical trials there are for diabetes, you would go to that, et cetera, et cetera.
Thank you. And I'm going to end with this last question. A person mentions that they have people that go to the appointments, but they're asked to step out. The DSPs are asked to step out, and they also won't give the nurse access to the medical records or to the charts for information that she needs. She said she's tried multiple approaches. Do you have any recommendations, any thoughts on how she can advocate to get the information that she
Well,
needs?
you know, a couple of things. Let me first address, you know, having a DSP leave the exam room. This is all, again, part of the preparation. The individual, the patient, should basically have a signed document that assigns eligibility to the person that's escorting them. You know, basically, sometimes HIPAA can be, and we want people to adhere to HIPAA, but we also want them to understand and not miscategorize what's going on. So having that preparation before the visit to ensure that you are eligible to hear that information is very, very important. You know, and also access to the medical records are very, very important, and it goes hand in glove with the HIPAA, you know, things. And very often, you know, if the individual has not been adjudicated incompetent, they can make that, they can make you the agent of that information. If they have been adjudicated incompetent, then basically it's the conservator who would be responsible for providing that eligibility for you to have access to the information.
So the person who asked that question provided a little bit more information, and this is actually probably a little more challenging. So the person with the disability has a guardian.
Correct.
The DSP and the guardian are at the appointment, and the guardian is the person who wants the DSP to step out, and the guardian is the person who doesn't want or doesn't allow the nurse to have access to the records. So that's a little bit of a different challenge, and to me it seems like it probably relates to having to educate the guardian maybe on the importance of why this information is needed.
Yeah, obviously a couple of things. One, the guardian doesn't have an appreciation for the role of the DSP. I always inform guardians and parents that basically the DSP, these are my words, they are essential health providers themselves. And basically they are part of the health provision team. That needs to be done. Now, there could be other reasons. There could be a distrust. There could be a bad history between the DSP and the guardian, et cetera. At the end of the day, the guardian basically has that particular right to dictate who gets that access.
Well, Dr. Rader, thank you so much for this incredibly important and very valuable information, and for taking the time to share it with me and with all of us today. And I look forward to the next time we get together.
Great seeing you, Greg, and thanks a lot for the opportunity to join you.
Absolutely. Goodbye, everyone. Thanks for joining us, and we'll hopefully see you on the next IDD Perspectives webinar.